Hospitals, the demand for personal protective equipment is becoming dire.
All of our hospitals are running low on PPE. They're all reusing masks. They're all having to sending fewer staff in to care for patients, putting patients with COVID together so that you can use the same PPE multiple times. So yes, everyone is running low on PPE.
Cassie Sauer, CEO of the Washington State Hospital Association, says this is what we want to avoid. In Italy, hospitals are overwhelmed, and public health officials are pleading for more equipment, including masks and ventilators. Here in Washington, the biggest needs include N95 masks, surgical masks, eye protection, and disposable gloves and shoe covers. The federal government says it's on the way.
We're doing several things. We're sending out the National Strategic Stockpile supplies. We've sent over 2 million masks to California, to New York, to Washington, to the places hardest hit.
Stop talking about it and start doing it. Move faster. This is a war. We need people. We need the manufacturers to manufacture. We need the federal government to let go of its national stockpile. We need these materials now.
Local hospitals doing everything they can to avoid a disaster. Here's a look inside the mission control in Gig Harbor for the CHI Franciscan Hospital System, a NASA-style command center tracking coronavirus cases at its 11 triage centers in real time, with doctors and administrators deciding where to deploy resources. As of last week, they had screened more than 10,000 patients. And individual doctors doing their part. This doctor posting a sign saying, "I stayed at work for you, please stay at home for us." Woodinville dentist Rama Escuyan is donating her protective equipment to local hospitals and calling on other dentists to do the same.
If we think about all these providers who have supplies, if they can be so kind enough to donate to our hospitals, we are going to run out. Our doctors and nurses and all those healthcare providers are going to run out PPEs, and we're going to have a disaster.
A region in need of protective equipment and rapidly running out. And it's not just protective equipment. Right now, the state health officer is coming up with guidelines on how to decide who should get treatment and who should be left to die in the event the healthcare system gets totally overwhelmed. But let's hope it never comes to that. Matt Lorch, Q13 News.
Well, crews are making progress.